Hey, hi everyone. I'm William, who is a registered pharmacist. I hope all of you are having a wonderful evening. Welcome to this Facebook Live that is brought to you by VitaHealth and HTM Pharmacy. We are happy to announce that this is our first collaboration, but it will not be the last. In fact, this collaboration consists of 6 episodes of Facebook Live, which we'll be doing on a monthly basis. And we'll be sharing on various health topics for the next 6 months. So please do like our Facebook page in order to get the latest updates on the health topics that we will discuss. Without further ado, let's welcome Edwin, who is a pharmacist from HTM Pharmacy. Welcome, Edwin.
Hi, William. Good evening.
Hi.
Good evening, everyone. My name is Edwin. I'm a pharmacist from HTM Pharmacy. Today, I'll be very happy to be invited to join this live session. So I'm very, very happy and very honored.
Yeah,
Thanks.
yeah, Edwin, and we are happy to have you also. Welcome. And first of all, I would like to take this opportunity to thank our viewers as well who show us support by watching our Facebook Live. Today, me and also Edwin, the both of us, will be sharing on common health issue which I believe retail pharmacists often encounter in their work and is commonly experienced by elderly people. And this problem will be joint pain.
Yeah, this is true, actually. As a retail pharmacist, more than
Mhm.
50% of my patients, they walk into my pharmacy every day complaining to me how painful their joints are. Especially the pain in their knees. Just give you some examples, the pain in the knees. Um, so joint pain, just let me briefly explain what's joint pain. Joint pain, in other words, is joint discomfort. They're usually found in hands, in feet, in hips, knee, or spine. Some people they experience constant pain, or some people the pain can come and go. But many people they thought joint pain only occurs among the elderly people. But for me, it's quite commonly seen among the young age.
Yeah, I agree with you. Because although joint pain is mostly found in elderly group, young people can also suffer from joint pain. And let me give you an example on this. Recently, a friend of mine who is just about my age, which is 20 plus, he complains about having knee pain.
Your friend is it?
Yeah,
Your friend. So I think your friend the age is only about 20
yeah, we
something.
are about same age, 20 plus. Lah.
Okay. So I believe that your friend has overworked his knee. Is he an athlete or hiker?
Yes, he is actually a very active person. He likes to do all sorts of intense sports like marathon and also like hiking. Yeah, so these are the sports that he played.
I see.
Hmm.
Um, so I think that's true because just let me give you some example. One example, I have patients who were walked into my pharmacy just a few days ago. He was about your friend's age as well. He complained to me the same condition. He had the same situation. His knee was very painful. Then further question, I noticed that he also used to hike a lot. He's a hiker. Then he found that his knee started to get painful after he came back from hiking.
Okay. Yeah,
Yeah.
I think it's
So
more or less the same scenario.
yeah, more or less the same scenario as your friend. When we talk about the joint pain or the pain like what your friend mentioned just now, what you mentioned just now about your friend, I think when the muscles, ligaments
Mm-hmm.
or tendons they are overworked, pain and stiffness can develop very quickly. So mainly there are two types of joint pain. One is called a sudden joint pain. For me, the sudden joint pain they can be due to mild muscles or ligaments sprain, dislocation, etc. But for chronic pain, the other types, chronic pain can be defined as the pain lasts for more than 3 months. There can be a symptoms of serious conditions. For example, RA, rheumatoid arthritis, OA, osteoarthritis.
Yeah, Edwin, I see that you mentioned about sudden joint pain, which is also known as acute joint pain and also chronic joint pain. But for his case, I think it wouldn't be a chronic joint pain because he has been
Okay.
having knee pain not too long ago, and for now he's okay. So
Yeah.
for him, I think should be acute joint pain. So why not the both of us share with the audiences about joint pain? So in order for them to understand better.
Okay, let me briefly explain to you about the joint structure and functions. Joint is the connection point between bones in the body to hold the skeleton together and support the movement. Basically, if your joints is your joint is not healthy, then your movement will be disrupted. You wouldn't have a very good movement. They consist of cartilage, ligaments, tendons, bursas, synovial fluid, and synovial membrane. For the synovial membrane part, right? Synovial membrane is the lining of joint capsules that secretes synovial fluid to lubricate the joint. And for synovial fluid, it's quite important to maintain a healthy joint.
Yeah, I see that you have explained about the joint structures, and I believe that each and every joint structure they play very important role to maintain healthy joints. So, but what are the common causes to cause joint pain?
One of the common causes of joint pain, I would like to say, is arthritis.
Mm-hmm.
There are two main forms of arthritis. I just mentioned just now the examples are osteoarthritis, OA in the short form, rheumatoid arthritis, RA. Besides that, joint pain can also be caused by some other factors or some other causes. For example, injury, like what your friend had experienced due to hiking, because he hiked a
Yes, that's
lot.
right.
Yeah, so he injured his knee. He feel very painful in the joints. The second one is obesity. This is quite common to be found in the patients. The heavier you are, the higher the risk you have joints, the joint pain in the joints. The other causes I would say is osteoporosis, gout, and probably some other causes as well.
Okay, so from the common causes which you mentioned, I can see that most are due to excessive stress or excessive weight that is being put on the joints and cause joint pain. So as we know, joint pain is a pain, right? So besides pain, what are the other signs and symptoms?
Talking about signs and symptoms, besides the very obvious, it is painful. Your patients
Mm-hmm.
complain to you that they feel pain in their joints. The other sign and symptoms probably is the area of the joints probably would be swollen. You have to observe. So usually I observe when the patients come into the pharmacy, their joints area part is swollen, red, and I will still ask them some questions. I ask them, would you mind to touch the part, which the swollen part? Do you feel a little bit warm? And usually they answer yes. That means when
Mm-hmm.
you touch the painful part, right? It is warm to touch. So the people who have joint pain might experience some limited movement, which eventually affect the quality of their life.
Yeah, well, Edwin, I would like to elaborate more on the synovial fluid, which you mentioned
Yeah,
in the introduction of joint.
yeah,
So
sure.
this synovial fluid is actually a viscous solution that is found in the joints. And in order for our viewers to have a better understanding about the relationship between joint and synovial fluid, here is a slide of the structure of joint. So as you can see from the slide, the synovial fluid is between the bones and there are many functions. So the first one, as you can see, it keeps the bone slightly apart so it can protect the cartilage from wear and tear. Second, it acts like a cushion which will absorb the shocks during movement, whether you jump, you run. So when you move, it will act as the cushion. And third, it can lubricate the joint, which help us to move freely and also easily.
Yeah, that's very interesting. Thanks for your explanation, William. So I
Welcome.
see that you mentioned about the function of synovial fluid in the joints, but as far as I know, there are a few components that make up the synovial fluid, right?
Yeah. Okay. Basically, synovial fluid it mainly consists of hyaluronic acid, proteins, collagen, and etc. In fact, according to a study, synovial fluid contains high levels of hyaluronic acid because it can help to maintain the viscosity of synovial fluid. So it simply means that when synovial fluid has enough HA or hyaluronic acid, then it will be viscous enough to cushion the bones effectively. So when it cushions the bone effectively, it can help to reduce the friction between the bones while we move.
Yeah, I agree. Usually, the pains that occurs is probably due to too much friction in between the bones.
Mm-hmm.
Uh, and what William you just mentioned just now, hyaluronic acid that can help to reduce the friction with sufficient or enough level of the enough level or amount of hyaluronic acid. I think friction can be reduced and hence lower the chance of getting joint inflammation. But I
Mm-hmm.
have a question for you, William. What kind of factors will lead to the decrease of hyaluronic acid?
Well, there are a few factors. Mainly, the factors that will decrease the level of hyaluronic acid in your joints will be, let's say, first one is your age. And this is a fun fact for your information. Hyaluronic acid is not just present in your body joints, but in the skin as well. So same like our skin, when we age, the level of hyaluronic acid in the body joints will decrease naturally. And this is the first one. Second one will be sports injury or aggressive movement. I believe that many of the sports lovers or gym goers, they will experience joint pain, especially in the knee after they have an intense sports session. This is because the HA, they might decrease when the synovial fluid that we mentioned, that play the role as cushion during vigorous sports.
Yeah, I agree, William. Because last time I was used to go to gym quite often also, and I sometimes
Mhm.
I also have some
Yeah,
some
me
joint
too.
pain. Yeah, you sprain sometimes you sprain use too much.
Yes, that's right.
But what will happen to the joints when the level of hyaluronic acid decreases?
Yeah, I mean, I think this is a very good question because you try to imagine that when hyaluronic acid level in the joints decrease, the synovial fluid actually becomes thinner between the bones. So when this happens, less synovial fluid can cushion between the bones. So any shocks, pressures, or vigorous movement will cause the bone cartilage, which is the protective cap that covers the end of the bone, to have faster wear and tear. Eventually, this wear and tear of the bone cartilage will lead to osteoarthritis, OA, as you mentioned. So eventually, it will also cause the joints to be painful, swollen, and have limited mobility or hard to move. So, Edwin, after talking about the factors and consequences of decreased hyaluronic acid level in the joints, I believe that you have met many customers who complain to you about their joint pain problem due to the factors that I mentioned, right?
Yeah, definitely, indeed. Because there are too many customers every day, every single day. They walk into the pharmacy, they complain to me, they
Mm-hmm.
are suffering from joint pain due to some reasons. Further question, they like to do intense sport. They sport a lot, for example, hiking, jogging, running. And some of my senior customers, they did complain to me that they have persistent knee pain. That means they have knee pain for many, many years or many months, which sometimes affect their mobility. They cannot move too much because they feel pain.
Mm-hmm.
So I think hyaluronic acid is really an important component which can help them to maintain the healthy joints and to improve their quality of life. Is what I think.
Yeah, and I think we do have the same mindset on this. I do believe that hyaluronic acid is definitely a nutrient that they need for healthy joints because it can definitely help people who suffer from joint pain and reduce mobility. Because this will put them in a situation where they cannot move freely and easily. But another thing is that when pain and osteoarthritis happen, surely there will be inflammation going on in the joint as well. So Edwin, is there any other nutrient besides hyaluronic acid that can help to fight against joint inflammation and help in joint pain?
Yeah, I think this is a very good question, William. Um, to be honest, of course, I would like to give you an example is
Mm-hmm.
MSM,
Okay.
also known as, also known as methyl sulfonyl methane. The MSM is the short form. It's a popular dietary supplement, can be used as a single agent, or sometimes you can see it is combined with other nutrients and purported to be beneficial for the joint pains. This
Mm-hmm.
component is rich in organic sulfur, is an important building block for healthy joints and to get a healthy bones as well. Besides that, they are found to be useful to boost up your immune system.
Yeah, Edwin, I see that you mentioned that MSM is a important building block for the healthy joints and healthy bones. So besides maintaining healthy joints, what are the other benefits of MSM to the joint?
Usually, the people they take oral MSM, the main intention is to reduce the inflammation of the joint during their joint pain due to its anti-inflammatory property. There are also clinical studies that show that MSM they produce a significant decrease in movement pain and improve the physical function. So this is very important because taking MSM can really help to improve your decrease the joint pain and improve the movement. So the patients they found that the patients with osteoarthritis, okay, they take
Mm-hmm.
MSM for 12 weeks and they showed improvement in joints and physical functions. For some people, they might have the questions for the OA case, how many the maximum dose of MSM they can be taken for every day? The answer is MSM can be taken up to 6 grams a day in 3 divided doses. The clinical studies they use up to 12 weeks.
Ah, I see. Okay, so I have talked about hyaluronic acid, and Edwin mentioned about MSM. So these two nutrients are the ones that can help to improve joint pain. Uh, So, but where can you find these two ingredients? You can find these two ingredients in VitaHealth Flexiplex HA plus MSM. This is a joint supplement that contains 60 mg of HA, hyaluronic acid, and 500 mg of MSM. In fact, according to a clinical study, these ingredients can help to maintain healthy synovial fluid, fight against joint inflammation, as well as to decrease cartilage surface degeneration. So with all these, this joint supplement helps to maintain healthy joint. Edwin, I want to know that there are actually other joint supplements in the market as well, such as glucosamine. But one thing I know is glucosamine is usually sourced from shellfish, and some people are allergic to shellfish. So, what is your view on VitaHealth Flexiplex and glucosamine?
Yeah, glucosamine definitely it is very very common, and um, many people they are taking glucosamine supplements. But glucosamine supplements, some of the glucosamine supplements they are usually sourced from shellfish. But
Mm-hmm.
when we talk about VitaHealth Flexiplex, which William recommended just now, this group of patients they can actually take VitaHealth Flexiplex because this product does not contain any animal source, so they don't have to be worried about shellfish allergy. But besides that, I think it's very very suitable to be consumed by vegetarians, as it is made from veggie cap. It is non-animal source. You don't have to worry about bovine. The capsule is made of bovine. Furthermore, I think it's very convenient also because this health supplements is just only require once a day dosing.
Yes, basically, it means that VitaHealth Flexiplex HA plus MSM is a vegetarian-friendly joint supplement that is suitable for vegetarians and also for people who have shellfish allergy to some other joint supplement like glucosamine. And besides that, one capsule of VitaHealth Flexiplex contains 60 mg of hyaluronic acid and 500 mg of MSM. And by taking this once a day is sufficient for helping in your joint pain problem.
Yeah. In order for the patients to have a better healing, while taking VitaHealth Flexiplex, hyaluronic acid plus MSM, I would like to advise the patients to combine with the healthy lifestyle, to modify your lifestyle. For the people who suffered from joint pain, we'll observe whether he or she is obese. If yes, then strongly suggest you to maintain a healthy weight, because every pound puts additional strains on your joints, increasing the risk of getting injuries as well, because due to the weight, the stress of the weight, and osteoarthritis, the risk of getting osteoarthritis. For the people who have weak muscles, it's probably a leading cause of knee injuries. So I would strongly suggest the people to go exercise more, so that you will benefit from building up your quadriceps, your hamstring, the muscles on the front and the back, on the thighs. And when the muscles get stronger, they can help to support your knees.
Yeah, as mentioned by Edwin, since muscles help to support the whole body structure, strong muscles can help us to support us better, and less weight or less stress will be put on our joints. Less damage will be caused to our joint as well. So it's very important to exercise more and maintain healthy muscle mass. However, for certain group of people who are having joint injury but would like to do exercise, you may consider switching to swimming or other low impact exercises, because this will put less stress on the joints, and it can help you to strengthen your muscle and accelerate joint healing. But at the same time, it will not cause further damage to the joints. Besides that, there are also other methods to relieve joint pain. First of all, of course, the most important one will be to rest the affected joint. Second is to apply ice on the affected joint for 15 to 20 minutes every 3 to 4 hours, because by doing so, it can help to reduce inflammation. And the next one will be to compress the affected joint. This is to improve the blood flow in the joint so that it can heal faster. And fourth, as mentioned, we have to do exercise regularly to build a strong muscle. And lastly, if the pain is unbearable, you may even consider taking painkiller. So, all right, the both of us, Edwin and I, have shared about joint pain, HA, hyaluronic acid, MSM, as well as the tips or preventive measures to help in joint pain, and of course about the product VitaHealth Flexiplex HA plus MSM. All right, so it has come to an end for our Facebook Live. And for your information, you may walk into any of HTM Pharmacist outlets to get professional consultations from their wonderful, fabulous pharmacist.
Yeah, definitely. The products we are talking about today is actually available in HTM Pharmacy, VitaHealth
Yeah, and it's
Flexiplex.
what Flexiplex, yes.
Yeah. So feel free to visit to any HTM outlet. We'll provide you the best advice.
Yes, and we also would like to remind our viewers that to like both VitaHealth and HTM Facebook page in order to get the latest updates from us and also to know more about the next Facebook Live. So Edwin, why don't we share about the topic for the next Facebook Live?
Yeah, I think it would be quite interesting, because in the next
Mhm.
Facebook Live, we'll be talking about health concerns that haunts many adolescents or people who have oily skin. You might guess it is acne or pimple.
Yeah, and it's about acne or pimple. So, all right, viewers, you heard Edwin. So, if you have acne problems and would like to know more, would like to learn more on how to deal with acne, to deal with pimple, please stay tuned for our next Facebook Live about acne or pimple. So, thanks to our viewers, and of course, thanks Edwin. Have a good
Thank
night.
you.
Thank
Thank
you.
you, William.
Bye.
Everyone. Bye bye.